I want to talk about organs of articulation for the IPA, the International Phonetic Alphabet. Before we get it started, I think it's meaningful to ask ourselves those three questions. The first question, why do we need to know the organs of articulation? Well, the reason of being is that it is the basic structure in the linguistic system that we can use it to study the place of articulation. Then we would ask ourselves, what is place of articulation study? Well, the place of articulation study, it is focusing on how the articulators cooperate with each other to form sound. Then we would continue to ask ourselves, why should we study the place of articulation? Well, firstly, it helps us to properly understand and describe speech sounds. Secondly, it helps us to pronounce words correctly. And possibly, it also helps us to learn a new language. Thirdly, it also assists us in the linguistics and phonetics study, such as manners of articulation, which is sorting out all sorts of place of articulations into a bigger category, and help us to pronounce the phonetic transcriptions properly, and also help us to analyze speaking languages. Now, in today's talk, I'm going to focus on mainly 2 points. The first point is that we are going to look at all those organ names through the oral tract. Second point is that we are going to look at those anatomical places of all those organs. So we are going to look at the vocal tract, the lungs, the larynx, the tongue, the oral cavity, and the active and passive articulators. Firstly, let's look at vocal tract. What is vocal tract? Vocal tract is the passage from the larynx, which is also called voice box, up through the pharynx, as we call it the throat, to the oral cavity, we normally call the mouth, and the nasal cavity, we normally call the nose, that shapes sound into speech. Generally speaking, in order to know the vocal tract, we have to look at the airflow, where it is from the lung till it is out of the mouth. So generally speaking, due to the construction of diaphragm, the air is pushed out of the lung through bronchi to the tracheal tube, then out of glottis to the pharyngeal cavity, then through either oral cavity or nasal cavity. Well, in order to get it into details, let's look at it closely. So by looking at those 2 pictures, we can see that the airflow is starting from the alveoli, which is looking like some slums of little bubbles, where the oxygen and carbon dioxide are exchanged. So to begin with, the air, which is a mix of carbon dioxide and oxygen, going through the bronchiole to the bronchi, to the tracheal tube, then through the vocal cords of the larynx, then passing through the esophagus and epiglottis to the pharyngeal cavity. So it is from the top end of the pharyngeal cavity, the air flow goes to either nasal cavity or oral cavity. Because there's no any other articulator organs in nasal cavity, so we are going to mainly looking at the oral cavity. So the airflow go passing the uvula and the root of the tongue, then go passing the soft palate or velar and back of the tongue, then go passing the front of the tongue and hard palate, then go passing the blade of the tongue and alveolar ridge, then passing through the teeth to the lips and out of the mouth. Let's look at the larynx. It's also called the voice box, where the vocal cords are located and vibrate to create the initial sounds. By looking at this picture, I would say the arytenoid and vocal folds together are looking like the shape of a scissor, where the arytenoid cartilage is looking like the handles of the scissor, and the vocal folds are looking like the blades of the scissor. And when the muscle of the arytenoid cartilage contracts, the vocal folds apart from each other. So when the vocal folds are split from each other, the space between those two vocal folds is called glottis. Glottis by itself is not the organ, but rather it is an empty place that is created by the aparting from those two vocal folds. Then there's a thyroid cartilage. The shape is looking like the horse hoof. Well, in order to know how it works, let's look at it closely. Well, from the first diagram, we can see that when you are holding your breath, the arytenoid cartilages are in the neutral position, and the vocal folds are tightly closed. From the second diagram, we can see the arytenoid cartilages are aparting from each other slightly, and it is in this position the airflow through the vocal folds and cause the vocal folds vibrating. That is, most of the sounds are made in this position. From the third diaphragm, we can see that the arytenoid cartilages are opening up and the vocal folds are aparting from each other. So the empty space, which is the glottis, is appearing. Mostly in this position, it is for the inhale and exhale, but it can also make sound, like the glottal sound, which is spelled phonetically as the letter H. Now let's look at the tongue. Well, the different parts of the tongue, such as the tip or apex of the tongue, the blade of the tongue, the front of the tongue, the center of the tongue, the back of the tongue, the root of the tongue, which are the most important components of the articulators, make contact with the varying parts of the roof of the mouth to create distinct sounds. we can see from this diaphragm that the tongue even includes the epiglottis, and it also includes those set rims and central mid-sagittal line. Now let's look at the oral cavity. The oral cavity includes the uvula, the palate. The palate divides into the velum, or soft palate, and hard palate. The alveolar ridge, the tongue, the teeth, and the lips. Now let's look at the active and passive articulators. So the organs of articulations we've just looked at, they can also be called the articulators. So what is a passive articulator? A passive articulator, it is a relatively stationary part of the vocal tract. Gets contact with an active articulator to create a flow of air construction and produce a speech sound. Passive articulators are including alveolar ridge, the teeth, hard palate, velum or soft palate, and uvular. What is active articulator? The active articulator is the movable parts of the vocal tract that move to the passive articulator to create a sound. The active articulators are including the lips, the tongue, the epiglottis, and the glottis. As we can see from this diaphragm, there is a curved line that is dividing those articulators. And those articulators are above this curved line are called passive articulators. And those articulators are below this curved line are called active articulators. Alright, that's it.